You will learn how to identify the signs of an ectopic pregnancy on ultrasound and assess the risk level of ectopic pregnancy to respond appropriately. A pregnancy should occur in the uterus. Any pregnancy that occurs outside the uterus is called an ectopic pregnancy. It usually occurs in the fallopian tube and happens in about 1 to 2% of pregnancies. Ectopic pregnancies do not survive. It is extremely important to identify ectopic pregnancies because they often rupture. This can cause life-threatening bleeding for the mother. There are several types of ectopic pregnancies which are named based on their location. An isthmic or cornual ectopic can occur in the fallopian tube segment that is just inside the uterus. This is particularly dangerous as rupture often causes massive bleeding. Other types of ectopic pregnancies include a tubal, ovarian, abdominal, and cervical ectopic. Any woman who has scarring and narrowing of the fallopian tubes is prone to ectopic pregnancy. This could be caused by a number of factors, including prior ectopic pregnancy, pelvic inflammatory disease, or a prior sexually transmitted infection, tubal surgery, history of infertility, or use of an intrauterine contraceptive device, or IUD. The use of an IUD does not increase the risk of ectopic pregnancy, but if a woman becomes pregnant with an IUD in place, the most likely location for the pregnancy is in the fallopian tube. Patients with an ectopic pregnancy will commonly report pelvic pain, but the classic signs of ectopic pregnancy include the 3 findings of pain, bleeding, and an adnexal mass. Pelvic pain and bleeding can have several causes. The 4 main conditions you should consider include a normal intrauterine pregnancy, an abnormal intrauterine pregnancy, an ectopic pregnancy, or a condition unrelated to pregnancy. For example, cervical polyps, a cervical precancer or cancer, and infections may also cause vaginal bleeding during pregnancy. Pelvic pain in pregnancy can also be caused by ovarian torsion, which means a twisting of the ovary, and appendicitis. This lecture will cover ectopic pregnancy, and we discussed abnormal intrauterine pregnancies in a prior lecture. We will not cover conditions unrelated to pregnancy in this lecture, but we may see examples in our clinical time. Remember that to confirm a normal pregnancy, you must see a gestational sac with a yolk sac or a fetal pole. If you see only a sac without a yolk sac or fetus, it could possibly be an early intrauterine pregnancy, an abnormal intrauterine pregnancy, or the pseudogestational sac of an ectopic pregnancy. If you can clearly identify an intrauterine pregnancy, there will be almost no chance of an ectopic pregnancy. If the patient has undergone infertility procedures, it is possible, although rare, to have both a normal intrauterine pregnancy and an ectopic pregnancy at the same time. For the care of a patient that has not had infertility procedures, identification of a normal intrauterine pregnancy means that she can proceed with routine pregnancy care. But if you have any clinical concerns, despite the ultrasound, don't hesitate to refer the patient to the referral hospital. A normal uterus with no gestational sac, meaning an empty uterus, could be an early intrauterine pregnancy, a complete miscarriage, or an ectopic pregnancy. On a scan of an ectopic pregnancy, you're most likely to see echogenic free fluid or a complex adnexal mass. You can see fluid in the endometrial cavity or see a thickened endometrium. But there are usually other findings. From time to time, you may see a gestational sac outside of the uterus. Bleeding from a ruptured tubal pregnancy is the main cause of death in an ectopic pregnancy. If you see a large volume of free fluid that is echogenic, this is a very worrisome sign for hemorrhage and ectopic pregnancy. In this sagittal view, we can compare smaller and larger amounts of anechoic free fluid in the pelvis. Please pause the video now to ask participants to identify the free fluid in these images. Here we have pointed out the free fluid with arrows. The small amount of free fluid seen in the left image may be normal. The larger amount of free fluid seen in the right image is more worrisome. Not all free fluid will look black. In this image, some of the fluid is black, but some of it is complex, with scattered echoes. This is common when a patient has bled from a ruptured ectopic pregnancy. Here we have labeled the anechoic and echogenic fluid, which is likely blood clot. This is a very worrisome amount of free fluid, and this patient needs immediate referral to a hospital. This is another example of how free fluid can look when there is bleeding from an ectopic pregnancy. Please pause the video now to ask a volunteer to identify the free fluid in this image. In this image, there's a large amount of echogenic material in the posterior cul-de-sac, which is what we call the space just behind the uterus. This is likely blood clot. Here is another example of echogenic free fluid in the posterior cul-de-sac. We have outlined the fluid here to make it more obvious. Another finding on an ectopic ultrasound is a mass in the adnexa, which is the region of the ovary and fallopian tube. The mass is usually complex and poorly defined. The mass could be a hematoma, which is a collection of clotted blood that appears solid. Or it could be the ectopic pregnancy itself. The mass may appear hypoechoic, hyperechoic, or have a mixed echogenicity. It may also contain a hyperechoic ring. Although the mass is separate from the ovaries, it is often difficult to identify them separately. The mass may appear very close or as a large ovarian mass.